I'm currently a common pleas judge, which is a trial level judge in Cuyahoga County, Ohio. I did start on a legal career after finishing in the National Football League. This career unfortunately has a way of having a lasting effect on your life, but I think most of us would still not trade what we did years ago for anything else. It was the greatest job in the world. I did come down here actually to have my knees checked out, and Dr. Hodrick was informed that I also had some shoulder problems, so he also looked at the shoulder, found that that was actually in worse shape than my knees.
Mr. Ambrose had a shoulder replacement. His condition was arthritis, which is common. Now, it's less common in the shoulder, but obviously he had lots of reasons to have shoulder pain and shoulder arthritis. His were mostly post-traumatic. You know, being the linebacker for the Cleveland Browns and performing at that high of a level for that long of a time, you're going to have injuries to your shoulder, especially playing that position. And he accumulated those injuries over time, which damaged his cartilage, which eventually caused osteoarthritis. Now, once the cartilage is gone, unfortunately the body cannot create new cartilage, so it needs to be replaced, and that's what a shoulder replacement is. We're effectively replacing that cartilage or that bone rubbing against bone with a new smooth gliding surface. So what we use actually is metal and plastic, and that's the new smooth surface.
The difference I've noticed between my shoulder pre-operatively and then post-operatively, and I've not even completed, all the physical therapy, I've already noticed a big difference. Matter of fact, even right after the surgery, a lot of the joint pain was gone, which actually had a lot to do with pain medication post-operatively could be reduced rapidly because I didn't have the arthritic pain in that joint anymore. I've noticed immediate results, and even now with the physical therapy not even being complete, there's a dramatic difference in the range of motion of that shoulder.
Anyone that has any kind of joint replacement, typically I like to ask, is this really affecting your quality of life? If it keeps them from doing things they enjoy doing or perhaps things they used to do, then it's a reasonable option. Now, we'll exhaust every conservative care thing that we can. That includes injection and medicine and physical therapy. But once those things no longer work and it's affecting their quality of life, then the replacement's a great option.
I'm very appreciative of the work that Dr. Hodrick especially and the staff did here. Everything worked out better than really any other surgery I've had to date, and I've had a couple. I think the job that was done here was first class, and I'm really appreciative for what they did for me.